Why is it so important to work with soft therapy versus aggressive therapy all the time? Easy explanation. If you're giving somebody a hug or somebody's hugging you and they come up to you and they grab you, they pull you in, they squeeze you nice and tight and hard, that feeling that you're going to feel and experience may be invasive, protection, on guard, defensive, because you weren't expecting it. Even if you were expecting it and you know that that's what somebody is like, the feeling and the experience for your nervous system for that aggression and that forcefulness is going to have a very different experience than if somebody came in, gave you a nice slow hug, pulled you in, soft but firm, held you, and you just felt connected and safe. So when we work with SRT and we work with the clients and the intentional focus on the nervous system and the fascial system, we are understanding that every single time we touch that body, their nervous system, their brain is going to have a response or a reaction. It's going to have a feeling, it's going to have an emotional response, it's going to have an energetic response, and we want to maintain a positive response. And we want to maintain a progression towards down regulation of their nervous system to the point where they can fall asleep on the table, to the point where if they're in chronic pain, they will allow you to completely take their body, their joints, their limbs into new ranges of motion in a safe, comfortable manner. They will actually allow their body to let go unconsciously because the nervous system feels safe enough to do so. So understand that yes, aggressive therapy is there for a reason and it has its benefits, but also understand that soft therapy is there for a reason. And most people haven't experienced a true, genuine component or haven't experienced enough sessions for new sensory input from soft therapy to understand and really be able to utilize both forms of soft and aggressive. Where do I need to be? What does my system need in this moment? Is it more of a soft approach that we need, or is it more of an aggressive approach? And so the component that we're trying to get people to understand in terms of SRT is helping them to integrate back into themselves, to pay attention to the subtle pieces, the soft, subtle movement of how this makes you feel. Not just what do you feel, but how do you feel? Does this position make you anxious? Does this position make you feel comfortable? Does this position provide a feeling of stress or tension? Or does this position make you feel like you're needing to get off the table, you're needing to move around? So all of those components are very important in terms of the healing process as well. Not just trying to correct or address a mechanical issue, but also understanding that there's energetic and emotional issues or components to those mechanical pieces also.